Imagine living with a condition that causes you so much pain, you're sometimes admitted to hospital 2 to 3 times a week.
They attempted to perform a keyhole surgery, but I don't think they could get through. So that quickly changed to an open surgery. So they kind of cut me from hip to hip.
That was the case for Carla Cressy, who spent 11 years with excruciating pain, bleeding, throwing up and passing out. It was during one of her many surgical operations that they eventually discovered what was wrong.
Once they opened me up, they found that I had stage 4 endometriosis, frozen pelvis disease, and they said that it looked like someone had poured cement into my pelvis. Everything was just stuck together by so much scar tissue and blood. They drained, I think, 2 litres of blood from my pelvis.
Carla had to have a total hysterectomy, which put her into surgical menopause at the age of 29. She's one of 1.5 million women in the UK living with endometriosis. That's about 1 in 10 women of reproductive age. Yet there's no test for it, no cure for it. It can be agony to live with, and up to half of women who have it experience infertility. We're taking a deep dive into endometriosis on the Sky News Daily with me, Sally Lockwood. And first today, we're going to hear from Sky reporter Charline Bou Mansour, who suffers with the condition herself and has done loads of research into how it's affecting women. Charline, I've been very drawn into your story and all the research you've done in this area. It's quite shocking what so many women are having to live with, including yourself. Just begin, if you can, by describing your experience with endometriosis.
So I started experiencing severe period pains when I obviously started menstruating. And I'd say from the age of 13, that's when it all started. And I knew that there was something severely wrong with me just by looking at the other women around me. They can go about their own day, go to school, do sports day and do all these things. And I knew that there was something really wrong because I was fainting, I was throwing up.
And was that every month?
Yes, it was every month. And that's also part of it, the anxiety of waiting for that to happen. But it's important to also note that endometriosis is not period pain. It's a condition where tissue that's similar to the lining of the womb goes elsewhere and spreads across the body. It was explained to me as if it's retrograde menstruation. Like, just imagine your period and bits of your period going up and into other areas, of your body.
How old were you when you eventually got diagnosed? Because it takes a long time for some people.
It was January 2020.
So how old were you then?
I was 26.
Oh my goodness.
Yeah, 26.
So it took well over a decade
26.
for you to be diagnosed.
Yeah.
Why was that?
I think it's a number of things. The doctors themselves don't have enough information on endometriosis. There's not enough research, there's not enough funding, there's not enough awareness, and women just go through it and they think that it's normal. They think, that's what I did, I thought that it was period pain. So I didn't realise that there was all this tissue that was spreading. I used to take paracetamol and ibuprofen and any meds that I could get my hands on just so that I can relieve the pain. It's just every month it's like, right, what shall I try differently this month? I got a TENS machine. That's what they give women when they're giving birth to kind of numb the pain. I mean, you're also bleeding in between periods. And I just didn't know what was going on. There's so many symptoms to it, being extremely fatigued, just not being able to do anything. And at that point, it was a relief to find out that that is what I had, because I knew that there was something wrong and I wanted an answer so that I can then go ahead and start doing my own research.
And through your research, you've met lots of women who also suffer with endometriosis and you've shared some of their stories. I was really struck by just how debilitating it can be living with the daily pain, and also the kind of bigger picture in terms of how it impacts your life.
Firstly, it's different for every woman. Secondly, imagine just waking up and feeling like you don't know if you're going to be going through a flare-up or an episode that day. You don't know if you're able to go to work, if you're able to just do your basic normal activities of the day. One woman was bedridden for 6 weeks. 6 weeks of not being able to go into work.
I can't keep living like that. I can't be off work indefinitely. I can't just be curled up in bed crying every day. It just feels like your insides are barbed wire, and just every movement just rubs the barbed wire, and it's horrific.
And do you know the guilt that they must feel? And just maybe people just don't understand, and they just think, well, why is she taking 6 weeks off work? Another woman, Carla, the founder of the Endometriosis Foundation, she had to have an emergency operation because she was in that much pain.
Charline, I listened to that interview you did with Carla. In fact, we played a bit of it at the start of the podcast, and listeners would have heard that she had to have a hysterectomy.
Yeah, so at the age of 29, she had to go through surgical menopause. That is a hysterectomy, removing everything. So all your pelvic area was removed because there was so much scar tissue and damage that they had to get rid of everything. She was lucky that she was able to freeze her eggs. But I always think, imagine the women who are not able to have children or find out too late. And that's also part of the problem. It's the late diagnosis. It takes on average 8 years to diagnose a woman. And some women go through even longer. It took me 14 years. Just imagine not knowing what is happening inside your body. I think that is the worst part of it all. Just not knowing what is going on, whether you can have kids, what are happening to your organs, and what you can do to be able to just live your life normally.
And it can have huge implications for a woman's fertility. Explain how much that is a worry.
I think from the focus group that I did, a lot of women, that was their main fear. It was not being able to have kids or struggling. It's a 30 to 50% chance for women to be able to have children if you've got endometriosis. But you just don't know, and there's not enough information.
Having these back-to-back surgeries has then led to like fertility problems for myself. So like with my fertility journey, right now it is a struggle. But if I was told these things at the start, just like with anyone else, then I would have done stuff that I needed to do. I'm 40 next month, but like, as you said, you're seen as a geriatric, and getting told that as well when you go into your appointments is horrible.
And it's just scary because you feel like it's like a trial that doctors are just testing out on you.
The overwhelming sense I got from the women that you spoke to was there was a sort of sense of almost invisibility that they felt in terms of suffering with endometriosis, and a sense of hopelessness as to how to deal with it, because there doesn't seem to be any good option.
That's exactly it. Yeah, so there's no cure for endometriosis. There's just treatment options. It's either go on the pill, the contraceptive pill, take medicine, or have surgery.
And how does a contraceptive pill help?
The contraceptive pill helps by masking the condition. It doesn't actually get rid of endometriosis. It stops your ovaries and everything from working, so it really stops you from having a period, which can, the same way that sometimes doctors advise women to get pregnant, it does not treat endometriosis. It just stops whatever is going on to cause the spread of it. That is what is happening.
And it only stops it for what, the 9 months that you're pregnant?
Exactly, and then when you give birth, it will start again.
It's a pretty extreme temporary solution, isn't it?
Yeah, especially for women who are struggling to get pregnant. It makes no sense.
From the research that you've done, is there anything that gives you hope that progress is happening?
I met a few professors who are really dedicated to trying to find not only a cure, but also a diagnosis, like care pathway. So one professor I met spent the entire lockdown developing a saliva test. And I think it was in part the similarities of the COVID test and how the mRNA in your saliva, working with AI, to try and find out if you've got endometriosis. And that's what he did, and he's developed it, and it takes a few hours for this test to work, because right now the formal diagnosis is surgery. But with this non-invasive test, you're able to then figure out if you've got endometriosis in a few hours.
After the break, we'll hear more from Charline, as well as one of the professors she's been speaking to who's actively working towards a cure.
Endometriosis is common. It's said to affect 1 in 10 women and those assigned female at birth. So that accounts for anything up to about 1.5 million people within the UK. So it's common as a condition like diabetes in women.
Professor Andrew Horne is Professor of Gynaecology and Reproductive Sciences at the University of Edinburgh. And Andrew has done loads of research on endometriosis, including work on new treatments and a potential cure.
It's defined by the presence of tissue like the lining of the womb, outside of the womb, and that can be found anywhere within the body, even in faraway places like the lung. But the commonest site is within the pelvis, on the lining of the pelvis often, or on the ovaries. But it's not just a disease of lesions as such, because the big problem are the symptoms that accompany it. And these are largely pain symptoms, debilitating pain with menstruation around period times, pain at other times within the menstrual cycle, pain with sex, pain with opening the bowels, pain passing urine.
The pain is such that it's compared to labour pain, which is obviously excruciating for women. But actually, when it comes to getting pregnant, having endometriosis can really impact a woman's fertility.
When I see patients who first diagnosed with endometriosis, I do try and be positive about the fertility side of things, because around 2/3 of people with endometriosis will actually get pregnant without any problems. There are a proportion of patients, around 1/3, who will have difficulty getting pregnant, but they often respond well to surgery to remove the disease. So if you remove it, then their chances of becoming pregnant significantly improve. Or if that doesn't work, if they have to go for IVF treatments, they often respond well to IVF treatments.
And actually, very often the advice from medics to women with endometriosis is to get pregnant in order to help their condition. Does it help? It seems like a pretty extreme thing to have to do.
Yeah, I mean, this is something that certainly we've been campaigning to make sure doctors don't tell patients, because obviously if you're a patient who's been diagnosed with a condition which affects your fertility, the last thing you want to be told is to go away and get pregnant. It's really insensitive. But I think the other thing is, whilst when people are pregnant, often their symptoms are better. And this is because when you're pregnant, your body's producing natural amounts of high levels of hormones, which actually can help to reduce the symptoms of the condition. As soon as patients end their pregnancies and have their babies, their symptoms tend to come back, unfortunately.
When you listen to women describing their ordeal and what they go through when they've got endometriosis, there really doesn't seem to be much in the way of a good option when it comes to treatment. It seems like there's a lot of surgery involved. They attempt natural remedies, but really on the whole, they have to live with a lot of pain. How far away are we from a possible cure one day?
So you're absolutely right. I think the options for patients with endometriosis are still quite limited. We're doing some work in Edinburgh trying to develop a non-hormonal treatment for endometriosis. Just very briefly, what we've done is we've demonstrated that patients with endometriosis produce greater amounts of lactate. So that's a byproduct of sugar breakdown within the body, within their pelvises. And we think that this is an important mechanism by which the disease develops. So what we thought was that if we could target lactate, we could potentially treat the disease. And we're currently working with a drug called dichloroacetate, which we've shown reduces lactate in both laboratory models and animal models of endometriosis. And we've tested it in an early phase clinical trial and shown that it seems to affect the symptoms of patients with endometriosis. We're just about to start a bigger multi-centre trial across the UK testing dichloroacetate. So we're very excited about that as a treatment for endometriosis.
Has this area of medicine been neglected when it comes to investment in research?
Oh, absolutely. Women's health in general has been neglected. And this is, of course, due to a lack of understanding, a lack of awareness about conditions which affect women. Of course, historically, a lot of decisions around funding have been made by men who maybe perhaps didn't understand the impact that these conditions were having, or maybe didn't even have any knowledge of them at all. And I think endometriosis in particular has suffered because it's, if you like, an invisible condition, and it's a pain condition, and people often try and mask their symptoms. So people sometimes aren't as aware of the impact that the condition is having. I think on a positive note, I think things are changing. Certainly in the UK, in the last few years, we've seen a much greater investment from the funding councils into endometriosis.
And just lastly, Press, you've chosen to specialise in women's health as a male medic. What have you learnt about how conditions affecting women are prioritised? Or is there a societal and historic cultural trend of just women suffering in silence?
I mean, if you look at a condition like diabetes, which obviously affects both men and women, and as I said, is as common as endometriosis, in a clinical setting, there's a huge infrastructure and support for patients with diabetes. You know, you have diabetic nurses, a whole diabetic team supporting you, and it's treated very much as a chronic condition. With endometriosis, it's always been treated in quite an ad hoc way. We've only recently had endometriosis specialist nurses. They're only available in the hospital setting. And I think, you know, talking to people like you about women's health conditions is really important and raises its awareness, and just shows how important it is we put more money and more investment into supporting and managing people with these conditions.
Let's just get a bit more from Charline now on her hopes for the future for women living with the condition. Now, we've got a lot better at talking about the menopause in recent years. Would you like to see the same thing happen when it comes to endometriosis?
Absolutely, yes.
And what difference would that make?
It's already made a huge difference. Just in the space of a few years, the presence of women speaking up on social media is huge. All they want to do is talk about it, because it makes you feel so alone going through it. And you just, especially when, as I mentioned before, there's so many women that don't experience the kind of severe pain that you experience. So the fact that there's a community online, the fact that there's more awareness and more charities doing their parts, just being able to speak about symptoms and treatment and what things worked for some women might help someone else.
And of course, you've done a brilliant job in giving so many women a voice when it comes to endometriosis. Charline, thanks so much for speaking to us.
Thank you so much.
It does seem to be one of those conditions where women can feel very alone, but I hope this podcast has helped prove you're not. Thanks very much for your company today. The Sky News Daily is back on Monday.